Good afternoon and thank you very much. Congratulations to the Congress Organizing Society, because this meeting has undoubtedly been a great success. I am going to present an update on photoablative cosmetic iridoplasty after a decade of hard work. First of all, I will remind you of each of the innovations that we have made in these 10 years, then the medical protocol of the technique, and at end, the procedure. Well, as a product of our innovation, we carried out preclinical studies on cadaver eyes. To assess the effect of 4 different lasers, we conducted preliminary clinical studies, and also introduced a new classification of iris pigmentation that did not exist before. We developed 3 mobile applications to take high-quality photographs of the patient's own eyes at his home, a predictor to be able to predict the result of the treatment, and another application to simulate the final appearance. We also created a new genetic eye color test to find out the patient's genes, an iris scanner with 3 modules: photography, OCT tomography, and tonography. 2 software, one to analyze the iris colorimetry, and the planner to plan the treatment. And all items grouped in the iris summary that includes the main parameters to take into account. Finally, a safety system with 3 factors: the top eye pressure after treatment, the trabecular blockage factor, and the clearance curve. Here is a summary of all these innovations. Upper left, we see the histology studies of 4 different lasers. In green background, we have the preliminary clinical studies of the cornea, the anterior chamber, the vision, the ocular pressure, and the new classification, with 5 pigment levels. On the right, with an orange background, we see the mobile applications and the 2 professional software: iSelfie to take high-quality photos, the predictor, the 3D simulator, and the iris analyzer. We also had to create a genetic eye color test for patients who were unaware of their ancestors, and thus be able to predict a more accurate result. We have incorporated several eye drops, such as hyaluronan, which contains a low dose of heparin. And at the bottom right, we see the iris scanner and the iris summary of the main features. The summary shows 4 maps: colorimetry, color contrast, pachymetry or iris thickness, and 3D topography, also physiodynamic parameters. The medical protocol begins, as in all techniques, with a clinical history and, the most important, how to rule out bad candidates, such as a family history of glaucoma, chronic eye diseases, serious general diseases under treatment, such as diabetes, and especially those autoimmune diseases, since they could generate strong eye inflammation after the laser. Secondly, we do a general eye examination, a specific eye examination, with the iris scanner, to obtain main parameters, a prediction of the outcome, a 3D simulation, informed consent, and planning of the phases. Here we see the informed consent, the list of contraindications, that also includes psychological and psychiatric disorders, such as dysmorphophobic syndrome, and the factors that influence melanin production, before and after treatment. Please see below an example of high-quality photos with iSelfie, a predicted result, and a simulation. At the top right, an iris summary, with 3D topography, and below a simulation showing the effect that ambient lighting and distance have on the eye color look. With low light, the color effect decreases; in darkness, it will not be almost perceptible. Regarding distance, the further away we observe, the less the effective eye color will be. We now move on to the laser technique, which, after 10 years of follow-up, is effective, safe, and predictable, but still performed through several phases. Grades 1, 2, and 3 can be completed in just a 4-day phase, but dark eyes require 2 or 3 phases, even with touch-up. We have already reduced the duration of each laser session to a minute or minute and a half. It is painless. The laser application does not produce pain or acute inflammation. We do not need contact. We do not touch the eye, nor do we use anesthesia drops, just a drop of artificial tear gel. It is an outpatient technique. The patient can carry out normal life without efforts. After 10 years of follow-up, we have already demonstrated the safety, efficacy, and predictability, evaluating the evolution of vision, pressure, refraction, and, as we see below on the right, satisfaction at first is not very high, but it increases a lot as we progress in the phases. At the end of treatment, when patients see final outcome, they are so happy. We now go on to show examples, first of heterochromia, congenital on the left, with large nevus, even the lower of half of the iris, and next to him, we see the results achieved. And on the right, secondary heterochromia, above a case after congenital cataract surgery, in a woman who underwent surgery in childhood. The middle photos are after trauma, before and after, and the last one is an example, secondary to prostaglandin eye drops use, with 2 indications, the lengthening of the eyelashes, such as the Latisse brand, and the regular treatment of glaucoma. Prostaglandin eye drops produce in a short time a really dark and hard pigment, quite difficult to remove fully. Now you can see cases of cosmetic indications of different grades. On the left, with low pigmentation before and after. In the central column, there are middle degrees, 2 and 3, before and after. And on the right, we see cases of dark eyes. Now I present a case from this week. It is a patient who came from Germany, with Horner's syndrome of the left eye, confirmed with the installation of aproclonidine, which causes mydriasis of the affected eye, but not of the healthy one. This patient had a positive test for aproclonidine. The initial appearance was of a partial heterochromia, with several nevi of different sizes, small and large. After a day of laser, the lower half was lightened. On the second day, we eliminated all the nevi, and clarified a large part of the heterochromia. The last photograph will be sent by the patient herself, from her home, by the iSelfie application, on her smartphone. To finish, we are starting an innovation phase, to achieve the maximum excellence, full safety without the need of phases, just like a myopia LASIK procedure, and also that all light and dark degrees could be completed in a single phase, with just 20-30 seconds laser duration. We have already achieved the rest of the advantages. It will be painless, without contact, without anesthesia, ambulatory, and without affecting vision or pressure. Although some inflammation will persist. And the results will also be visible after 2 or 4 weeks. Please watch this awesome video. Here you can see the technique we want to reach coming soon, a breakthrough technique by a new laser with an accurate eye tracker that will follow eye movements and everything done in just 20-30 seconds.
What I have to do?
New laser will incorporate eye tracker. Also pattern mode with 50 shots in a second. All safety systems to guarantee success.
That's right.
Thank you so much for your kind attention, and we'll keep in touch for this breakthrough technology.